Okay, gentlemen and ladies, are we now ready to start? I think the mayor is already here with us.
Excellent.
Okay, good morning and good evening to you, people at the other end of the planet, especially those in Sebastopol, California, in Hawaii, and our friends at Calgary, Canada. So to begin with, may I call on past President Fernando Dean Camba for the opening prayer. He is presently at Zamboanga City Water District, his office. PP Ding.
Okay, good morning and good evening to everyone. I know if you can hear me loud and clear.
Yes, PP Ding.
We can.
So I'm inviting everyone to pause for a moment of prayer. Thank you, Lord, for this wonderful and amazing blessing of today, for your word of hope, which gives us strength, for your love that makes our lives meaningful and purpose-driven, for your grace that renews and restores our life, for your continuing blessing of opportunity to serve others, for making us your instruments in promoting your goodness, for the blessing of partners who continue to help us and our communities. For all these prayers, we give you praise and glorify your name. Amen.
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 So again, good morning. Again, good morning and good evening to our friends in the other side of the planet. Today, after more than 3 years of planning through our Rotary connection with California, Hawaii, Canada, and Nepal, inspired by the Rotary themes of serving humanity, of making a difference, and of opening new opportunities, we shall finally launch and turn over this pilot telemedicine project, I think the first in Mindanao, and probably the first of its kind in the country. So I am Fernando Nanding Yu of the Rotary Club of Zamboanga City West, and I will be your host today. Welcome to this launching and turnover of the pilot telemedicine project for Zamboanga City Medical Center in the heart of Zamboanga City and Vitali Lying In Clinic, located 75 kilometers east of Zamboanga City. We would like to welcome our guests and stakeholders. On my list is the Honorable Maria Isabel Beng Climaco, City Mayor, Zamboanga City. I don't think if Dulce Meraviti is with us this morning. We're hoping that the Regional Director of the Department of Health, Dr. Joshua Brillantes, will be able to attend. Ms. Teresa Camba, Regional Director, Department of Information and Communications Technology, Region 9. Our stakeholders, Mr. Michael Cook, President, Global Offsite Care Telemedicine. He's based in Sebastopol, California, USA, and a member of the Rotary Club of Sebastopol Sunrise. We have also Ms. Farhin Abasi, Director for Operations of Global Offsite Care and member of the Rotary E-Club of Silicon Valley, California, USA. We are also waiting for Dr. Sally Belinque of the Rotary Club of Calgary and Gerald De Mello. We have also Rotarian Jim Becker, also known as Kimo of the Rotary Club, Rotary Club of Halo, Hawaii. Or the others. I'm expecting to see Governor Louis Gonzaga to be part of this activity this morning. Of course, I would like to welcome our Rotarians from the Rotary Club of Zamboanga City West, headed by our President, Hill Lim, who is with me at the back. So at this point, may I now call on past President Jose Vicente Atelano to give us an introduction and little background of the telemedicine project that we are launching today. Si JB. Hello, JB. Is JB around?
Parang wala.
I think JB is not around, but he told me this morning that he will be able to present. So in behalf of JB, I will just read to you, the little background of the telemedicine project. Telemedicine is defined by the World Health Organization as the delivery of healthcare services where distance is a critical factor by all healthcare professionals using information and communications technologies for the exchange of valid information for diagnosis, treatment and prevention of disease and injuries, research and evaluation, and for the continuing education of healthcare providers, all in the interest of advancing the health of individuals and their communities. Amid the COVID-19 pandemic, which began in the Philippines on March 2020, the Department of Health and the National Privacy Commission have developed a framework for telemedicine services in the country in a bid to improve access to health services during the enhanced community quarantine. Under the DOH-NPC Joint Memorandum Circular, medical consultations over the phone, chat, short messaging services, and other audio and visual conferencing platforms are considered telemedicine services. Healthcare providers conducting these consultations are allowed to issue electronic case reports and prescriptions. And to date, there are at least 5 hospitals in Manila and 2 in Cebu which have been granted telemedicine accreditation by the Department of Health. The telemedicine that we are piloting in Zamboanga today is unique because it uses the state-of-the-art Kubi telepresence robot. The Kubi offers a highly engaging virtual presence in the home, clinic, and telemedicine office. Healthcare providers can easily look around remotely with 300 degrees of pan and 90 degrees of tilt to see and interact through remote robotic control during a video call. Remote healthcare clinicians can see and interact with patients, families, and their teams. More than this, the telemedicine that we are piloting is unique in the sense that it will use the technology of Dharma, a solution built to empower frontline health workers, clinicians, and health systems leaders by delivering information and insights about the health of an individual, communities, exactly where it is needed in real time. This telemedicine being launched today is just a pilot for Zamboanga City Medical Center and Vitali Lying-in Hospital. In the near future, we are looking at expanding the service of telemedicine in other rural health units in the barangays, municipalities, and provinces, especially in the island province of Basilan, Sulu, and Tawi-Tawi. The objective is really to enable our health experts in Zamboanga City to remotely diagnose and recommend treatment to patients at their hospitals without necessarily bringing them to Zamboanga City. The initial funding of this project is not really significant, but we consider this a breakthrough because this will serve as the beginning of something huge in the coming days. So at this point, I would like to call on the president of the Rotary Club of Zamboanga City West for to give special thanks to the people and organization behind the realization of this project. So President Hill Lim.
Okay, good morning, everyone.
Pa-mute lang yung ano ninyo, Sir Nanding.
Okay.
Must be two people in the same room signed in.
Yeah. Morning, everyone. On behalf of the Rotary Club of Zamboanga City West, I would like to give special thanks.
Unmute all other laptops. All other laptops, please unmute. I mean mute. Only the president should be unmuted.
Hello.
Okay.
Okay. Are we okay? Okay. On behalf of the Rotary Club of Zamboanga City West, I would like to give special thanks to the people and organization behind the realization of the project. One of the founder and prime mover of this pilot telemedicine project is Global Offsite Care. Global Offsite Care is a US-based nonprofit, humanitarian, and all volunteers organization formed in 2013 by a group of Rotarians who saw the opportunity to help prevent and cure disease by promoting Rotary Club's sponsored telemedicine project. It has a board of directors with 11 members from 6 Rotary Clubs. Currently, it has 18 telemedicine projects in 11 countries, 6 countries in Africa, 3 countries in Asia, and 2 countries in the Caribbean. The pilot that we are launching today is the first in Mindanao. The other very important partner of this project is the Department of Information and Communication Technology, headed by Director Maria Teresa Camba. They play very important role because of the department provided the much needed Wi-Fi data for the telemedicine to properly work. The other stakeholder are funders are the Rotary Club of Calgary, Canada, District 5360, represented by Rotarians Gerard De Melo and Dr. Sunny Belenki. Rotary Club of Hilo, Hawaii, District 5000, represented here by Rotarian Kimo Becker, who is the Vice President for Global Telemedicine Projects. The Rotary Fellowship of Rotarians Doctors based in California. Rotary E-Club of the Southwest. I'm not very familiar, but we would like to thank Dharma for working on the data processing for patient referral. Of course, I would like also to acknowledge the responders to the birthday of past President Fernando Nanding Yu for raising for the telemedicine project. Our very own Rotarians and Anne, Jenny, Jerry, and Lani Berar for the Rotary Club of Zamboanga City West. Past District Governor Ronnie Gabalda of the Rotary Club of Iloilo South. District Governor-elect Edwin To of the Rotary Club of Zamboanga City. Ms. Carmel Mahonik, based in Las Vegas, Nevada. And Assistant Governor Patrick Lee, who patiently took time to canvass and finally purchase the telemedicine equipment. Again, in behalf of my Rotary Club, I say thank you and God bless.
Very nice.
So again, thank you to our the acceptance of this project which is based in Zamboanga City Medical Center. Dr. Kunting.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم السلام عليكم ورحمة الله تعالى وبركاته. Good morning, everyone. Buenos dias a todos in the vernacular of Zamboanga City, Asia's Latin city. The Zamboanga City Medical Center would like to thank the various individuals and organizations that has helped us achieve one of our goals. As you know, the Zamboanga City Medical Center is the tertiary referral hospital, and we've been receiving many patients. And for many years, we've really wanted to be able to bring medical care down to far-flung areas so that even they don't need to come here for medical services and help decongest the hospital. For we see so many primary cases when in fact we are a tertiary referral hospital and we should be looking at tertiary cases. Now, this telemedicine presence, telemedicine project allows us to be able to serve primary care needs of individuals in the community. It's a win-win situation for all of us, actually. A win for us because we now are able to decongest. It's a win for the patients because they don't need to spend so much coming here. Vitali is about 74 kilometers away. And it's a win for our rural doctors as well because they now have the specialists of the Zamboanga City Medical Center to back them up. So it's really a great pleasure. And as we were talking previously, this is just the start of a bigger relationship. For the Zamboanga City Medical Center, we would like to link up with more of the rural health units on the City Health Office of Zamboanga City, and later on link up with hospitals and rural health units in Zamboanga Peninsula, Sulu, Basilan, and Tawi-Tawi areas. And maybe later on in the future, be able to connect and link up with other Asian countries who share the same problems and the same things that we are experiencing right now. Hand in hand, we'll work together to make better health something that is achievable for our people and the nations of the world. Thank you very much, and muchas gracias for this great help.
Bravo, Dr. Kunting. This time, I would like to give the floor to the Director of the DICT, Tess Kamba, for the project ICT support. Ma'am Tess.
Hi, thank you, Nanding. Hi, everyone. Good morning to all those who are in Zamboanga City, and good evening to our friends and partners from the Rotary International community. Let me start by congratulating everyone, including the Vitali Lying In Center, the Zamboanga City Medical Center, and the Great West on this handover of the telemedicine project. And at the same time, thank all the partners for their support and contribution to make this pilot project in Zamboanga City a reality. Hands off and congratulations, especially to the Zamboanga City Rotary Club of West for always coming up with innovative, high-impact projects such as this one. We at the Department of Information and Communications Technology are very pleased and honored to be a partner in this project. The ICT, as I mentioned earlier, during our informal conversation with our partners, is the primary policy, planning, coordinating, implementing, and administrative entity of the executive branch of the government that plans, develops, and promotes the national ICT development agenda. Our role in this project is to provide internet connectivity. As you all know, internet is a very critical component of this telemedicine project. Since major telecommunications companies do not have good internet service facility in Vitali, we deployed VSAT with at least 35 Mbps bandwidth, which we launched last Saturday. Secondly, well, our support does not end there because we can also provide ICT training to the men and women who are in Vitali, particularly those who are operating the machines. Third, I'm happy to know of the planned expansion of this project to other remote hospitals, especially in geographically isolated and disadvantaged areas. So you can rest assured that the ICT will be willing to support this as well and provide the necessary internet connectivity as usual. So thank you very much for this opportunity given to the ICT to serve the people through telemedicine. Congratulations to everyone. Back to you, Nanding.
Yes, Ma'am Tess, I saw you post in the Facebook that you were somewhere in Tawi-Tawi and Zulu the past 2 weeks. So you were just simply
Yes.
installing Wi-Fi connection in that area. So when this
Yes.
is done,
That is
maybe
right. Yeah, that is right. And I actually visited the Sulu Provincial Hospital, and this telemedicine project is actually doable also for them. I hope we can also help them. They have
They're
X-ray,
very
but
good friends. They're very good friends, and we are really willing to help them. It's just a
yeah,
matter of
let's
the
talk.
infrastructure being in place. Yes.
Yeah, we just connected them. We just provided internet connectivity to the Provincial Hospital of Sulu.
We would love to.
yeah.
Excellent.
So thank you everyone for that. And at this time, I would like to call on the mayor of Zamboanga City, Maria Isabel Climaco, for a message. Mayor Beng. Mayor Beng, are you there?
Yes. Sir Nanding, good
Oh, this
morning.
is Dr. Dulce Maravite, the City Health Officer.
Yes, good morning, Sir Nanding, and good morning, everyone. In behalf of our City Mayor, Mayor Maria Isabel Climaco, we would like to thank everyone. No, so we are glad that we have finally launched this pilot telehealth in Vitali Lying In, and we are also grateful to the ICT and our Rotary International and Rotary West Club here in Zamboanga City, and of course, syempre, ZCMC for always doing innovations and partnering with the LGU in making innovative ways to have better service delivery in the city. So thank you very much.
Thank you, Dr. Dulce. Thank you. So we'll be expanding this, according to Dr. Afdal, to other rural health units in the within the city.
Yes, sir.
So,
Thank you.
yeah, at this time, maybe we can have a word from the president of Global Offsite Care, who is really the prime mover of this project in Zamboanga, Mr. Michael Cook.
You can call me doctor, but not a medical doctor. But I am a big fan of such things. Thank you everyone for attending this event. It's a major milestone for global telemedicine and for Zamboanga City because it shows how persistence furthers. As Nanding noted, we've been working towards establishing a telemedicine project in Zamboanga City for 3 years now. And Nanding's been a consistent and patient advocate for bringing the telemedicine project to Zamboanga City and has introduced many of our fellow stakeholders to the project. The Global Telemedicine Program has evolved since we started it 9 years ago, even as broadband access to the internet has expanded with the installation of fiber optic connections, such as we just heard about, and including in the Philippines. The understanding and appreciation for the potential of telemedicine has expanded and evolved too. As a result, telemedicine is becoming more feasible and well supported. So we're excited about how much support there is available, especially as we're learning from the Philippine communities that are welcoming this project. An example of this expansion is our awareness of newly available and affordable tools being used in the developing world for telemedicine. Digital stethoscopes, dermatoscopes, and a very promising handheld ultrasound probe, all being actively evaluated in this program now. And we anticipate they could play a role in helping particularly the remote areas to better diagnose their patients and get teleconsults better informed by having digital images and other data available to their consultants. And we hope that Zamboanga City and nearby areas will be among the pioneering users of these tools to help push the capacity of telemedicine and fulfill on its great promise. We're at the beginning of a new phase and look forward to working with Dr. Kuntang, Rotarian Nanding Yu, and all the stakeholders in this project to demonstrate what can be done now. Thank you.
Maybe we can have a few words from Kimo or Farhin to give us maybe a little of history how this project was finally launched today.
Well, I'll go before Farheen. Thank you, Nanding. And by the way, in each one of the locations that we have around the world, we have a champion. And in this case, we have Fernando Nanding Yu, and you truly are a champion. Because, yeah, please, we always have our global telemedicine expansion would not occur if it wasn't for the volunteers and especially the Rotarians that believe in service above self. So I think when we started talking 2.5, 3 years ago, we started talking to Nanding about what to do in Zamboanga City. We call it Z City, by the way. And he brought to us the idea of really expanding services with our friends in Calgary. So I don't know how many hours we've spent on Zoom, but it's like we wake up in the middle of the night and we think we should be on a Zoom call, But it's hundreds of hours, Nanding, right? That we have been on Zoom, yes. So, but you are truly the champion. And I'd just like to say, yes, this project, this pilot project lays the foundation for us to come and expand in the southern part of the Philippines and do other expansions using ZCMC as the base. And, without that base, we couldn't be able to expand. So the success of this pilot project is going to allow us to move on to do something bigger and use the internet and the Wi-Fi in order to expand through other hospitals, clinics throughout the area. So with the base of ZCMC and what we're establishing right now, that's the basis of how we're going to build this up and to be a further strong way of supporting the people of the Philippines using Wi-Fi. So that's what we're all about. And, when we talk about expanding to other Asian communities, we want to, because of the internet and the way we can do this around the world, we want to also exchange with other medical services throughout other countries like Nepal, China, Thailand, Laos, Cambodia is a community that we want to work in, and also throughout other nations in the world. So look out for us. We're going to be coming big in the future. And again, all of you, thank you so much. The Z City West Club, we honor you. And I know Michael and I, and hopefully Dr. Good and Farheen, we all want to come and visit you soon. So look forward to seeing us and meeting us in person.
Sure.
Mahalo and aloha from Hawaii.
Thank you.
Thank you. The other one is Dr. Good. Dr. Good.
I just give a few comment, brief comment. This is a very impressive beginning. You have all the elements. You have the hospital, you have the physicians, you have the needy population. You've got a wonderful start, and I'm very impressed with what Chemo has done and what our leader Mike has done, what Fareen has done. They've really opened doors, but you're the ones who've really created this. We're going to assist you every which way we can. So you have our pledge that we'll do all we can to help you help your people using technology, education, being able to do consultation, and also education. Please join us in our grand rounds. For example, this Wednesday, we're talking about the interaction of COVID-19 and cancer. What is the interaction? And really, what has to have to do with mortality? How does one make special preparations in terms of cancer patients? What are the mortalities? But we're reviewing the whole topic of COVID-19 and cancer, particularly hematological cancers and lung cancer. So do join us for grand rounds if you have a chance. It's not on your best time, but it's there. It's every Wednesday at 8 to 9 on Pacific Standard Time. And I want to congratulate all of you for this being a very successful project that opens up the Philippines and really opens up Asia. You've done a wonderful job. I salute you. Wonderful, wonderful.
Thank you. Thank you. Thank you.
Well, I think unless Farheen would like to say something, then we are done with this project launching this morning.
Should have a group photo.
Group photo. Screenshot. Group photo.
Pwede na mag-screenshot ba yun? So we will have, we will have the group picture.
For a while. Okay. Smile, people.
In 1, 2, 3, smile.
We should take a moment and thank Risa. Also, Risa is our new liaison who joined the project kind of in midstream and has really helped out and taken hold and moved things ahead, particularly with the Dharma platform implementation. I think accelerated that. So she's lurking on this call. I just wanted to say thank you for all your help, Risa.
Thank you.
Yay, Risa. Yay.
Farheen, would you like to say something?
If you want me to, but
Yeah.
I mean, everyone took
Of
everything I
course.
have to say. So, but thank you so much for allowing me to be a part of this project. I really enjoyed meeting everyone, working with everyone. As Chemo Jim said, I am very excited to meet you all in person one day. And of course, for those of you who are fasting or will be fasting soon, Ramadan Mubarak to everyone. And I really hope that this month of fasting is blessed for you. And again, thank you very much. And I'm looking forward to meeting you all in person one day.
All right. Likewise.
So thank you everyone for this morning's launching of this pilot telemedicine project at Zamboanga. So we are finished. We are done.
Thank you very much. Well done. Thank you. Thank you.
Thank you all.
Yeah.
Thank you all.
Thank you.
Goodbye.
Appreciate
Thank
it.
you.